Um, we're moving on now to Ben Smith, the last person presenting in this part of the day, just before the break. Ben Smith completed his PhD in psychology from the University of Southern California in 2019. He's an independent data scientist based in Auckland. And in some ways like Ananish, he's published multiple scientific papers in psychology and neuroscience. He previously worked in data science at TradeMe and at Facebook. So Ben's with us now. He's going to be talking about border, safely opening a border, and he's got some data to show us as well. Over to you, Ben. Mute.
Thank you very much, Mark. So, kia ora koutou, good to see everybody today, and I will get a presentation up on the screen for you. Right. Great, we're underway. So a little bit about me. I think, thanks for the introduction, Mark. I have recently become interested in taking a look at modeling border risk and looking at the risk, because what I could see in the international data was a large set of differences between countries based on the amount of COVID-19 they have in the community there. And I think this is quite relevant to consideration about which countries we might allow into travel between New Zealand and which countries we don't. So I built the model in an interactive web app that you can check out online, and I approached Dr. Thornley to look over the work and sort of look into the epidemiological aspects. And today I want to take you through what I've found. So what I want to do is show you that excluding the world from New Zealand is not zero risk. People from many countries are very low risk, and we could actually reopen the border to many countries without substantially increasing the risk to New Zealand. So in the status quo, we're currently bringing in around 9,000 people to New Zealand each month. And actually only around half are New Zealand residents and half are people who have an essential skill. Most, or they have other exceptions for coming into the country. Most are from high prevalence countries. So this is June to 2020 data, and this is the this is looking at the based on the June 2020 data of people coming into New Zealand, as well as the prevalence of COVID-19 in those countries. And what we're seeing there is that we predict most cases that we're getting coming into New Zealand come from the US, Australia, India, and the United Kingdom. But the status quo costs us. Tourism is around 6% of New Zealand's economy. International education is 2% of New Zealand's economy. New Zealanders also like to travel, and there's not a lot that we can do right now when the borders are shut. And more than 1 million New Zealanders were born overseas and likely have family and friends overseas. Many of us do. I'd estimate more than 1 million all up. And so there's a lot of different restrictions that the border controls place on us, and it's not just the economic situation. Peter Gluckman, Helen Clark, and Rob Fife wrote a piece not too long ago. They said, do we continue as we are now indefinitely, relying on a strict quarantine and a giant moat? We must prioritize exploring the ways in which we can more completely re-engage with the world. So what can we do? The first step to think about what we can do is to understand that countries are not all the same. The graph here is an estimate of infections per million of COVID-19 in selected countries, and there's a huge range among countries where we have quite a lot of travel between. And that ranges from Taiwan and Thailand, where there's actually 0 active cases right now within the community, right up to the United States, where they're seeing 12,000, 13,000 infections per million across the country. And the infection rate of travellers coming into New Zealand currently, if you consider that we had 30 COVID cases coming into New Zealand in July and 9,000 travellers, that works out to be 3,300 per million. So let's see how that looks when compared to countries where we have travel. Many countries are indisputably and clearly much less than that. So they have 0 COVID-19 cases. And right now, the Cook Islands, Fiji, Samoa, Taiwan, and Thailand all have 0 COVID cases. And they're all worth pointing out because we typically in normal times have a lot of travel between these countries. Right now, we don't have any travel except for New Zealand citizens and rare exceptions. And it's not clear why, given that these countries right now are COVID-free. There are other countries that do have some level of community transmission, but it's a low risk level. So you can see here on the graph, New Zealand, as of Saturday, had around 5 million infections per million within the community. So that's a lot less than what we have coming in. And so I think it's reasonable to understand why New Zealanders are really worried about having more people coming in from outside of the country, because you can see the current rate of travellers of COVID-19 among travellers coming back to New Zealand is pretty high. But when you look at other countries around the world, you see an opportunity to bring in more people to New Zealand that will not bring up the number of infections that we bring into New Zealand substantially. So for instance, China has been in the news a lot and has been associated with COVID-19 because the virus initially started there, but it seems that the virus is very much under control in China now, and from the international data, we can estimate only less than 1 infection per million in China right now, substantially less than here in New Zealand. Queensland also around the same level, less than New Zealand. Malaysia, Sri Lanka, and South Korea do have some level of clusters of cases. However, those levels of infection prevalence within the population are substantially lower than what we're getting coming into the country right now. So how do we control imported cases? Controlling importing COVID-19 cases, it depends on 3 main things. The first is the prevalence in source countries. The second is the volume of travellers incoming. And the third is the quality of our border control. Right now, overseas prevalence of COVID-19, and generally speaking, is high. We're looking at that 3,300 per million figure. And so what we're doing is reducing the volume of incoming travel to keep the cases controlled. And we're saying, well, we can only have New Zealanders and then rare exceptions like essential workers coming in from other countries. And that keeps our expected cases to a minimum, although as we have recently seen, even with this strict control, we cannot completely keep the virus out of New Zealand. But there's a better way. We can split out prevalence by source country. Some countries are high prevalence countries like the United States and the UK. There are other countries that have a moderate level of prevalence, such as Canada and Germany. And then you have countries with little or no prevalence, South Korea, Thailand, Samoa, and Fiji. And so we can split out countries into different levels, and then we can think about the level of border control that's appropriate for each level. So for high prevalence countries, we may want to stick to allowing only New Zealand residents and rare exceptions into the country. But for moderate prevalence countries, perhaps there's scope to allow more travellers into New Zealand with a strict border control. And that may mean the existing 14-day isolation applies, and quarantine applies to travellers from those countries. We might not get a lot of tourists coming from those countries, but perhaps people who want to get a job here or want to visit family for an extended period of time may want to take advantage of that. Then you look at the low prevalence countries, and we can see that perhaps, I'll go through the risk. It seems like there's a fairly low risk of opening up a more permissive border regime for those countries. And what we can see as well is that the border controls themselves can help control the volume. So when we apply that strict border control, we're unlikely to see so many people coming through those moderate prevalence countries, and that helps us to moderate the risk. So the modeling suggests high prevalence countries are responsible for most cases. Let me take you through the two graphs on the screen. So on the top, we are looking at the cumulative monthly arrivals for June 2020. Last month, 2 months ago now. This is the latest data that Stats NZ have released, just came out a few days ago. We had around 9,000 travellers coming into New Zealand, and you can see from which countries they are coming. Largest is India. The United States is also there, not too many though, quite a few from China. Most of the rest are from Australia, different parts of Australia and the UK. Now then you look to the second bar at the top bottom of the screen here, and it looks a little bit different. So the colors are the same, it's the same countries, but there's different proportions there. This is the expected cases at the border that we can model based on the prevalence of COVID-19 in each country. So for instance, the United States feature relatively small in the top graph. They might be around about 10% or less of incoming arrivals, but based on the high prevalence of COVID-19 in the US, we'd estimate they may make up the 20-30% of the cases that we've had coming into New Zealand in June, those 30-ish cases. On the other hand, China, although we have had possibly around the same number of travellers coming from China as from the US in June, we wouldn't expect any COVID cases from China due to the low prevalence in China right now. And that's not something that I have checked back with the customs services. They haven't made that information available, but that's something that you could verify. We could verify going back to customs to see are these figures what they're expecting. So what does a staged reopening look like? So I've built a web app that allows us to examine changes in real time, and I'll go into that. What we can do here is track the prevalence of COVID-19 in different countries around the world. And we can take a look at the figures. So we can see here, Fiji, Taiwan have no active cases right now. Thailand has just a few. China has a few more. But then you can see that in terms of the infections per million within the population, those numbers are very low for all of those countries. And the data are updated every day from Johns Hopkins University for the COVID-19 data and Statistics New Zealand for data for people traveling into New Zealand. Now, we don't simply take the case counts as we've heard today a lot. The case counts across different countries can be unreliable. It's likely that no country is accurately recording the true number of cases in their community. But what we can do is use the death rate or the fatality rate to estimate how many cases these countries have had. So international studies based on the Diamond Princess ship have estimated that there are around about a fatality rate of about 0.6%. And we can then compare that to the case fatality rates observed in different countries to see how much undercounting they're doing. For instance, the US has had around about 1,000 deaths per day in the last 7 days, and they've had around about 66,000 cases. And that suggests that they're undercounting their cases by a factor of about 2.5. That can be contrasted with the UK with 30 deaths and around 700 cases. it looks like they're undercounting by about a factor of 7. So we can adjust the cases based on the active official cases to estimate how many infections they've got. And we can see in the case of the US, they're reporting 1 million cases, but based on our tweak, we can estimate they may have as many as 3 million active infections. And that will give us a prevalence that's a little bit more reflective of the actual rate of COVID-19 than the official case reports. So when we do this, we can see, and we use these data to predict how many cases coming into New Zealand based on those prevalence ratings and the number of people coming into the country. We can see, and we can predict around about 30 cases coming in each month. And what you're seeing now is the prediction from the model I've described. And that matches pretty closely the actual number of imported cases that the Health Ministry has reported. That's the dotted line on the graph at 35, the active cases reported returning July 2020, and models predicting around about 30. So it's a pretty close match. And what we can also do then is weight up the figures to take into account perhaps travellers have a slightly higher prevalence than general population. Then we can take the data and we can look at how that might work out to be cases in the community. So Sean Hendy's research group at the University of Auckland has estimated a success rate of our quarantine system of around 99%. So we can work out that perhaps that 30 cases a month could work out to be around about 0.6 cases in the community that may be entering the community through a quarantine breach or some other problem. So the web app I've built allows us to simulate scenarios. What if we allowed people from Taiwan into New Zealand? Or what about Australia's ACT? Or what if we tried a 20-country scenario? So I've done that. I've taken the 20 countries where New Zealand has the most travel and taken a look to see how risk would change there. And it seems like under the status quo, we're having around about 6.6 cases exposed to the community each month. That equates to around about 7 a year. With 20 or 15 new countries out of that 20, we can open to 15 countries, and the risk raises only about 1 case a year. And which countries would go into those buckets? So Cook Islands, Fiji, Samoa, Thailand, Taiwan, and ACT, they all have 0 cases right now. We could open the border completely to these countries with no risk at all. As long as we keep modifying those countries to make sure that they continue to stay in their COVID-free status, we can be confident that receiving travellers from these countries, we're not going to see cases coming in. There are also very low prevalence countries, most of Australia, China, and Malaysia, where there's very low levels of cases. South Korea and New South Wales, it's not very low, but it's low, and we could also allow in quite a few travellers from these places safely. And then there's moderate prevalence countries, and these countries would definitely need to continue applying a hard 14-day quarantine for people coming in. But if we were to do that, we would not face a lot of additional risk. And that's Japan, Germany, Canada, Hong Kong, and Singapore. There are no interventions safe enough right now, in my view, to allow people to fly directly from the UK, US, and Victoria. However, you could allow people to come from those countries if they flew to one of the safer countries, quarantined there for 14 days, and then came on into New Zealand. So countries can move up and down risk tiers. We see countries have resurgences of the virus as extra clusters break out, or they get on top of it. And that's why it's important to keep an eye on this data from day to day. If New Zealand were to open a border, we'd need some sort of kind of a classification system so that we could understand when to open up the border to a country and perhaps close it again, and when we could open up to new countries we were previously closed to. So why should we bring in more international visitors? It allow family travel for hundreds of thousands of Kiwis. So just in the COVID-free countries I've talked about today, 150,000 people in New Zealand were born there, and most of them will have family back in those countries that that would like to see now and then. from the low prevalence or moderate prevalence countries, there's around about 70,000 students that we see every year in New Zealand. And right now they can't come in. But if we were allowed to allow them to come in through the 14-day quarantine system, we could bring back around 70,000 students a year and get our education, export education industry going again. And skills for the economic rebuild. So you can see this is the Google Trend demand for jobs in New Zealand search in the United States. And there was a marked increase in searches for jobs in New Zealand in the United States by Americans when that lockdown period began, suggesting, we have an opportunity to take some of the world's best and most talented people right now, if we're able to open up to allow them to come into the country in a sensible and safe way. So thank you for listening, and I am open to questions.
Thanks, Ben. That is fascinating stuff. My first impression is that it shows that with the right application of data and thought around how you construct, how you use it, you can come up with a practical solution to not only letting people in, but perhaps many other problems that we face. A question there, looking at some which has come up. How quickly though could we adjust that data to take account of changes in countries?
Yeah, so the data is collected daily by researchers associated with Johns Hopkins University. That's posted online, and then we can pull that data as soon as it's posted by them. I think it's usually mid-afternoon, around about now actually, New Zealand time. And so when you go into the app that I've created, then you will see that data coming in right away. It loads it straight fresh from Johns Hopkins every time that you open the app.
Mm. Do you have any comment perhaps on the reliability of the infection or cases that we're getting through from other countries? Because that does, over the course of today, we've seen some skepticism about reliability, variation between countries about how they're counting. Yeah.
So I have made an assumption in this work that even though countries may not be, and almost certainly are not, reporting cases properly, they're probably reporting fatalities well. And there may be some different views on this, but when I look at the excess death rates, they seem to more or less line up with the COVID-19 fatalities that are being officially reported. So my view is that in the main, those numbers of fatality counts are generally reliable. There are countries where the health systems are less developed, where we would want to be more cautious. So for instance, India, I haven't made any assessment about India in this model because I'm not so sure the data will be reliable, looking at a measure of how developed their health system is. But if we can look to a country that has a health system at least developed enough to report fatalities accurately, then we can use those fatalities to understand how much cases are being undercounted, and then weight up the active cases to estimate how many actual active infections are out there in their country.
A comment from you perhaps on the psychology of the thing. It's perhaps thinking about it, it seemed to me that this data or this format, this calculator, could have landed well if it was presented to the public a few weeks ago before the latest cases with the outbreaks. Do you think, given, as I assume from this, that it seems to assume that there are going to be cases that will appear even if you let people through, do you think people are willing to handle that risk?
What I can see is that even before last week, we were looking at some risk, and it was really seemed to be the case that in the status quo, we're still getting around about 0.5, 0.6 cases a month, or expecting a small number coming into the community. I do think that with an outbreak in Auckland right now, and I'm here in Auckland and can't leave to come to Wellington. It is on people's minds, and I think people will want to be more cautious. But I think reopening the border as a project, that could be something that takes a little while, and we need to be thinking about it now, even if we're not ready to do it now.
Right. So this model could be used to allow a staged entry of people or opening up of our border.
That's right, and so people like Professor Michael Baker, the epidemiologist at Otago, has suggested, maybe we start with the Pacific, and then look at Taiwan and other places that have eliminated the virus.
Now, as I understand it, other countries in Europe have opened up their border and then closed some of them. They seem to be doing an interchangeable borders between countries. They're deciding not to do. England decided recently to shut down with Spain with some changes there. Are they using models like this, or are they doing it somehow different?
I haven't looked in too closely, but I'm aware they do have some kind of a classification system where they're monitoring outbreaks in other countries and making decisions about the restriction they're placing on other countries as a result. And you can see on the page here that, for instance, France had previously been a country of concern, but at least in July, they'd gotten rid of enough cases where they'd be considered moderate under this model. So, in Europe, you're seeing that some countries are getting on top of that virus. And so it's unsurprising that they're thinking about ways to handle risk proportionately.
So there's a question just popped up. Can this tool be used to model comparisons between New Zealand and other countries? Could you run the same data through to see what's happened with other countries that have opened up their borders?
Yeah, that would be very interesting. I think I am not aware of, I think Thailand was looking at opening up a border, but so far they've got it closed. I think you'd look to places like South Korea and Taiwan, perhaps, rather than looking at countries where the border was previously closed and then opened. You might look at the levels of cases that are coming in from different countries. So you could look at a country like South Korea or any other country that are having people coming in, and they release data on where those incoming cases are coming from, and you could look to see, all right, well, based on the numbers of people coming into that country, and then from each other country, and the number of cases that are being brought in from each country, does that suggest that the prevalence data that I've used here is a reliable way to measure the prevalence of COVID-19 in travellers from each country? So I think that's a great idea.
Right. One other good idea, possibly. Were you here for David Katz's presentation at the start of the day?
Yes.
He's got a mitigation strategy. Be possible to use your model to apply those kind of strategies? So by that, it means different ways of applying what people can and can't do when they're in New Zealand, either as citizens or visitors.
Yeah, absolutely. So I haven't thought about what people could do while in New Zealand, but certainly, if we were running a strategy that was not full elimination, it could be that we still want to moderate the amount of spread. We still want to flatten the curve. And so it may still be important to control the number of people coming from high prevalence countries.
All right. Thank you, Ben. Thank you very much for your time. That is fascinating. Thanks for all your work.